What's up, y'all? This is Carolina Doc PT, 13-year veteran of the physical therapy industry and licensed and practicing doctor of physical therapy. And in today's video, we're going to be talking about some products that I currently and in the past have been using with patients of mine um, who have had knee replacements. So these are some products that I've found work really well and have gotten some benefit from them. So I wanted to call them to your attention in case you wanted to try to get them yourself and see if they would work for you and have with the same success that I've had with some of my patients with them. Let's get to it. So the first product is something that is really critical, and uh, it's going to be really necessary for all of you patients who are just out of the surgery itself. So within the first day or two, and then as you continue to go through your recovery, you'll wean yourself off of it and then use it sparingly. And but it will still be beneficial to you later on as you're recovering as well. But just not to the extent that you will use that when you first get out of the surgery and come home. And that is going to be an ice pack. So you probably have already are getting something similar to this when you come home from the surgery. Although not always. I've had to have patients actually order some of these on their own as well. But a lot of times you'll come home with a knee wrap with a ice chest, and you'll just keep refilling the ice chest, and it'll continuously circulate kind of cold air around your knee. One thing that I do find with patients, they don't, those things will get cold, but they don't always get cold. And your point, the point of using an ice pack early on in the recovery process is you're wanting to calm that inflammation as much as you can. You're trying to push blood flow away so those inflammatory byproducts from the surgery are just calming down. And so you need it to be cold to push that blood um, away. So these ice packs I think are great for that. The ColPac is really the only kind I've ever used in physical therapy. Just in the clinic, we actually have sold these as well and would sell these to patients. This the black kind. Is this would be a good one. I think this is the 11 by 14 size. They also make this big bad boy right here. So for those of you that really want to get your knee warmed up, this I generally use for a back, but this is I believe the 12 by 18 and a half version. But this is great for covering larger surfaces. But these things, these cold packs, um, are really beneficial early on. Even if you had that ice machine that the hospitals a lot of times will send home with you. Like I say, I've had patients who actually will use these types of packs as well, just because it gets colder and it just will help. So they may use the ice machine for a little bit, take that off, then let the knee get back to just regular temperature, and then go to the cold pack to like really get things cold, and then come off of that, let it get back to normal temperature, and then put the ice machine back on just for comfort. But just gives you something or gives you some options, in other words. So these, I did want to show on Amazon how much these actually cost. So let me do that for you. So this is the pack that I'm talking about here on Amazon. And under this, for this one, you can let's see, these things generally run about $27 or so. Um, if you go down, you actually can see that underneath this on Amazon, they have different sizes. The one that I was showing you, the black one, is this 11 by 14, and then this 12 by 18 is the bigger one that I was showing you. You can see it here on this. Yeah, that uh, on her, she's actually kind of smaller, but you can see how the back kind of would go. Then you can also use it on your on your legs and Yeah, that should, yeah, there we go. That was the picture I was looking for. So that's the 11 by 14. So that's more on our thigh, but you can move it down to around the knee. So these things are great. Also, something that we used to have always talked about in the clinic is the difference in the blue and the black. I I swear that the black gets colder. We actually haven't tested it. We probably should, but we think that the black ones get a little bit colder, but the blue ones, I don't know. You can take your pick. But this I will put a link at the end of this video and or just underneath this video that you can click on if this is something that you would like. Also, one other point about these things. So a lot of times the gel packs are going to come with sleeves with them. That is not what you're getting with this. You are just getting the ColPac, like what you're seeing right there. So what we always do in the clinic is we'll use this with a pillowcase. So you're going to want to have a very thin barrier between your skin and this cold pack because this cold pack can freeze colder than ice. Um, I have a funny story about that, but I'm gonna save that for later. But this can freeze colder than ice, so you want to have a thin barrier about the size of your pillowcase. So what you're going to do is you're going to take this out of the freezer, then slide it into the pillowcase. The pillowcase will go directly on your skin. Yes, you can put that over top of the Aquacel dressing that is typically over your knee. That won't be a problem with that, but you do want to have that uh, pillowcase as just a thin barrier to help prevent causing frostbite because, as I say, this will get colder than ice. But it does not come with a pack. You will have to provide that. Do not put this directly on your skin. As I said, this will cause frostbite. So it's got to have a thin barrier. So if you get these, that is the one thing about this type of pack. It works great. We use these in the clinic, and these are their preferred ice packs and go-tos. But anyway, so that is the first product that I think could really benefit you in recovering from your knee replacement. All right, now for the second product, this is a favorite in pretty much all PT clinics. Matter of fact, we sometimes have sold these, but this is called a stretch out strap. These things are great. This has, you see, it has these loops. These loops are about every 6 inches down the entire length. I think there are 10 of these going all the way down. So this, you can see it's called here. You can see mine that's very well worn here, but it's called the OPTP stretch out strap. So this is the original stretch out strap. These things are great. This will be, you generally are going to use these about when you're progressing along after you are about 2 to 3 weeks into it. Generally, when you first are starting your outpatient rehab, then that's when you're going to go to more active assistive range of motion for your knee. So that at this point, you've been working on it for 2 to 3 weeks on just trying to bend it yourself. And so now you're going to put this bad boy, you're going to put the loop on the end around your foot, and then you're going to go up and you're going to hold on to one of these other handles on the strap, and you're going to, as you're bending your knee back, you're now going to provide a little bit of additional pull through the strap to provide that active assistive range of motion to try to improve your knee range of motion. Generally, I'll have patients pull back, hold it for about 5 seconds, and then straighten it out again. So these things work great for this purpose. You can see these are nylon, so they don't give. A lot of time patients will ask, and if they're wanting to use these at home or use things at home, they'll say, "Well, I've got some resistance bands, and can I use those around my foot?" And you if they were strong enough, yes. Most of the time, they're not going to be strong enough. Most of the times, those are too springy. You need to have some resistance to it, and it needs to be strong to be able to hold on, or as you're pulling it, to be able to uh, pull into that resistance that your knee is going to have. So the the resistance bands are not going to work well unless you have one of the really thick, heavy duty kinds. And even then, they don't have the handles going up and down it. Now, sometimes patients, if they didn't want to purchase one of these, you could use a beach towel. So I've had them, hold on each sides of a beach towel and then pull back, and that can work. But this is the preferred method. This thing works great. Also, and let me show you on a picture here. So let's flip over to the website. So this picture is what I wanted to show y'all. So you can see this is the stretch out strap. These things cost like $15, and not very expensive at all. And this picture right here, there you go. So you can see how that's going to be beneficial for you later on down the road. We use these things really throughout the recovery process. You from your knee replacement. So you'll start lying down on your back and provide that active assistive range of motion. But then as you continue to progress, this is what I would like to do with patients. And I like to do it with patients that have been, they're close to discharge. They've done great with their therapy, and now you want to try to provide some additional range of motion to their quadriceps. And this particular stretch right here is great. But you can see the top choice of physical therapist since 1993. And you can also stretch your hamstring. You can also, there are other things like this. You can stretch your calves out. There are all sorts. Like, it'll come with a little exercise book here. That's what that is. That shows you different things that you can stretch. But so this thing works great. I think you would love it if you're interested. I will also have a link for this at the bottom of this video, and you can click on that and see if this is something that you want to order from Amazon yourself. All right. All right. For the third product, I actually don't have this myself that I can show you, but I can go on the website and have you take a look at it. All right. So this is what I want to show you. So this is a mini exercise bike. This thing, whoops, that's showing it with the hands. That's not as good. So yes, you can stand and do that, but that's not what we're trying to get out of this. So these pedals, you put it on the floor, and then this right here, this works great. When we were in home health, had a PTA who would bring these and have them have their patients work with these things. These are great, especially early on. That you can see that how this works. You just set it in front of the chair, and then you can get on and start pedaling. Now, when you first start using these, especially when you're in the home health phase of your recovery from your knee replacement, those first couple of weeks, this you're probably not going to be able to get these pedals to go all the way around in a circle. Maybe, depending on how far you put them out, but you see that bend in the knee right there. That is something that we're going to be working on with this. And the great thing about these is, one, you can either, if you can make it all the way around, then great, you can do so. But normally, what you're trying to do is you're going to go back and forth, okay? And you're just going to, because your knee is not going to be bending as much. Actually, this is interesting when you look at both of this woman's legs. This would be like kind of what a knee range of motion might look like early on, and this is what what we're trying to get it to. But this these pedals work great. As I say, if you can't fully pedal them around, you just rock your legs back and forth, and you just pedal them back and forth. And a lot of times, you do that, for a little bit, and then all of a sudden that knee loosens up and you can pedal them around. Another thing that these things are good for are actual pain control. So I had a patient who he had a knee replacement from a surgeon that was out of the area that we typically live in. And this orthopedist practice was very interesting because what they actually sent in to the patient's house was a much larger version of these exercise or this exercise bike. But because it had the computer console and everything, and so they sent this into the patient's house for him to use during, again, that first 2 to 3 weeks of his therapy. And what he used to do would be to actually get up at night. Like if his knee was really bothering him, it was really aching, he would get up at night and just pedal. He would just rock his knee back and forth, have it go around. And he said that that helped him to tolerate the pain in those first couple of weeks so much better. So this mini exercise bike will be really good earlier on in your recovery from the knee replacement. But this thing works great, and this particular version is not terribly expensive. It's only like $25, which is not too expensive at all. Now you can go down and they make all sorts down here. You can see like they have like these are $139. I think this is one that it actually provides some more resistance and stuff. You don't really need you wouldn't want that early on. Like at this point, you want very little resistance. You're working on range of motion at this point in the rehab. Now, as you continue to go down, go through the process and you're recovering and as your function is improving, then yeah, you could add some resistance there. And so that's, one of these might be better for that. But anyway, so this is a mini exercise bike. So you can see how much they cost, and you can get this from Amazon. I will put this in the link at the end of, or at the show notes below this video. All right, and the last product that I wanted to introduce y'all to and show y'all some information about is going to be the foam roller. These things are great. These are some of my favorite devices. I use them and have used them all the time. Like this is a typical go-to for most physical therapy patients that come in with some sort of hip pain, knee pain, etc. So where this is going to be beneficial is it can be beneficial early in the process if, like, say you're having a lot of quad pain, like pain up on the thigh. You can gently roll this, and the whole purpose of this is it's a myofascial release technique when you're using these foam rollers. And so what you're trying to do is you're rolling over kind of an area where there's some soreness, there's some dysfunction, and pain, and we're trying to get blood flow to get pushed away when we're rolling across it, and then blood flow comes back when you roll over top. So that on off of the blood flow in that area, that can help to bust up inflammation. It can help to actually stretch out the fascial layer. This is a layer of well, it's called fascia. It sits right above your muscles. It kind of holds your muscles tight, sort of like Under Armour underwear does around your legs. So that's the idea, but it's internal. It's underneath your skin. It's on top of the muscle, and it helps provide a little bit of internal support. Well, sometimes that can get bound up. That can, especially with inflammation in the area. So rolling and this type of foam roller across that area can help to break that scar tissue that can develop, or those early stages of scar tissue development. It can help with that. It also, as I say, helps with blood flow and gets blood flow changing up, so it can help with inflammation. So these things are great early on in the process. As I say, you're not going to be anywhere close to your knee with this early on in your recovery. You want to stay away from that, especially those first 2 to 3 week stages. You can target, as I said, up on around the thigh and higher up near your hip, or on the side of your leg, but stay away from anything close to your knee, anywhere close to the surgical incision site. That's not what this is for. Early on. Now, as you continue to progress, and so now you're going into the 6 week, 8 week, 12 week phases. You're probably going to be sore a little bit. Your hips are probably going to be sore. A lot of times, the other hip, the opposite hip from the side where your knee replacement was done, that hip itself might get sore. So using this foam roller to roll around there, you can put it on the floor and roll it. These things work great. It's one of my favorite devices. I'm probably going to do a whole separate video on these things, and there's so many different kinds of these, and I've used them all with patients. I've done work with thousands of patients at this point with these, and they can be really, really beneficial, especially when you combine them with a stretching program and things like that. So the foam roller, excellent device. I highly recommend that you get one of these at some point during the recovery process. Not as needed early on, can be beneficial, as I say, for like thigh pain, but or a little bit of hip pain, but it's going to be this is something that's going to be more beneficial to you down the road. So let me see on Amazon, how much are these things? All right, so for this on Amazon, this is $12. So these things, as I say, this is uh, for that price, excellent device, and you can sort of see here, like so that would be more for the gluteal muscles, which really get jacked up sometimes. But that's kind of the idea of it. You can see kind of how he is working on it there. Um, and as I say, I'm gonna do a whole separate video on this because this is one of my favorite products to use with patients. You can also see down here they do also make all sorts of these things. You know, this gets really intense when you start getting using these knobs. So I'd be careful doing this. Actually, what this woman is doing in this video here, like this would be lighting up most patients. It's not going to feel real great. Um, but you can see they also make different sizes. If you look here, so there's a 12 inch, that was the one that I was just showing you, but they make 18, 24, and 36. Doesn't really matter. I find that in the clinic, I have these 24 and 36 because that I'm actually using that on another person. So it helps to have a larger roll to be able to do that. But if you're just doing it on your own, a 12-inch one right here is really all that you need. And there are the density of the foam can also be a thing. So in our clinic, like we have a white one that is really, really soft and it's very pliable. And then we go up to actually some of these ones that are like solid cores. And as I say, I'll be doing another one. This is just a little introductory on these things. But it looks like this is more just a color preference because the density of that foam looks like it's all about the same. And I don't think, let me see if I don't think I see anything where they're saying anything about, yeah, it's the same polypropylene. So there's no difference in this. This is just a color preference for these. But do be aware that sometimes these foam rollers will have, like, if it's white, it's really light and it's not very dense. Then there's a light gray one that is also, it's a little bit stronger. And then when you start to get to the black ones, then they're becoming a little bit more dense. And the higher the density, then the firmer they're going to be. The firmer they're going to be, the more intense it's going to be, which can be beneficial. But anyway, so that's probably more than y'all want to know about this. So sorry about that. All right, let me come out of this. All right. All right. So we're back. So those were 4 products that I would highly recommend you taking a look at. I have had a lot of success with all of those. I've had extensive history using all of those products. So I think that they could be beneficial to you. Also, I mentioned that I am putting a link down below this for all of those products. Also, I just signed up to be an Amazon affiliate, or excuse me, an Amazon associate with affiliate marketing. So if you purchase any of these products from using the links down below, then that's something that you can do to actually help this channel. And yeah, that would be much appreciated. So do take a look at those. And if this video has been beneficial to you, then we would ask that you give us a thumbs up. Also, if you haven't subscribed, if you would click the subscribe button, because that certainly will help us to get more information like this out to you. I am going to be doing another video in the future on those foam rollers. I love doing myofascial work. There's a lot to that, and so we'll be doing that and probably showing, actually showing a treatment and showing how you can do that as well, because that can be really extremely beneficial to patients. But anyway, I need to go ahead and cut this off. Thank you all for tuning in, and good luck with your knee replacements. I hope you have much success with it, and we'll be saying prayers for you that you do. All right, later.